Dental implants, the hidden truth. You were promised a permanent, lifetime fix, a flawless, natural-looking smile that would last forever. But the dental industry has a devastating secret about one of the most expensive procedures: dental implants. While sold as the perfect solution for missing teeth, there is a hidden, insidious failure rate they rarely discuss. In this crucial 3D deep dive by Dental Vision 3D, we are going to expose the science of osseointegration and reveal the three biggest, most costly risks, including the silent killer that destroys implants from the inside out. Prepare to see the shocking reality that every implant patient deserves to know before signing the consent form. To understand failure, we must first deeply understand success. Our 3D animation now illustrates the process of osseointegration at the microscopic level. We see the titanium screw, often featuring a specially roughened or porous surface, surgically placed into the jawbone. This surface topography is critical. The jawbone, recognizing the titanium as biocompatible, initiates a complex cellular response. Osteoblasts, bone-building cells, migrate to the surface and begin to synthesize new bone tissue, physically growing around and fusing to the titanium post. This fusion process takes between 3 and 6 months and is the absolute foundation of success. If this process fails, often due to premature loading, poor bone density, or biological rejection, the screw fails to integrate and loosens. But even a perfectly integrated screw is vulnerable to the long-term, invisible threat we reveal next. The number one reason most implants fail after 5 to 10 years is not bad surgery. It's the progressive, silent disease known as peri-implantitis. Our 3D visualization now shows this process in slow motion. Bacteria, accumulating due to inadequate hygiene or excessive cement, quickly colonize the space beneath the gum line. Critically, the implant lacks the protective, shock-absorbing periodontal ligament that natural teeth possess. This absence allows the bacteria to launch an immediate, aggressive assault on the bone surrounding the titanium screw. We visualize the two types of bone loss: horizontal bone loss, melting away uniformly, and vertical bone loss, creating deep pockets. This is the silent killer because it rarely causes pain until 50% or more of the supporting bone structure has dissolved, rendering the implant unsalvageable and requiring drastic, complex remedial surgery. A major hidden cost and time risk, often minimized by clinics, is the necessity of pre-surgical bone grafting or sinus lifts. Our 3D model now focuses on the upper jaw, showing the massive maxillary sinus sitting directly above the bone where implants must be placed. If bone height is insufficient, a sinus lift is required. We visualize the delicate process of surgically cutting a window into the sinus wall, gently lifting the sinus membrane, and packing the space beneath it with bone grafting material. We also detail the different graft materials: autogenous, patient's own bone, versus allograft, cadaver bone. This procedure adds $3,000 to $5,000 to the cost, and more importantly, extends the healing timeline by 6 to 9 months, often frustrating patients who expected an immediate fix. The risk of graft failure or sinus membrane perforation during this stage is a huge, expensive complication, often overlooked. We've already uncovered the financial and time risks of grafting, and the biological risk of peri-implantitis. If this detailed 3D breakdown is helping you protect your health and your wallet, please take a second to subscribe to Dental Vision 3D. And tell us in the comments, did your dentist fully explain the risks associated with bone grafting before your procedure? We want to hear your story. The public often focuses solely on the price of the screw, but that's a mere fraction of the true investment. The second major operational risk lies in the crown and the abutment, the connector. Our 3D model compares a mass-produced, off-the-shelf abutment versus a custom, computer-milled abutment. We visualize how non-customized parts leave small, microscopic gaps where bacteria relentlessly thrive, drastically increasing the risk of peri-implantitis near the bone line. Furthermore, we visualize the catastrophic consequences of a poorly placed implant crown on your bite or occlusion. A crown that is even a millimeter too high or misaligned creates occlusal trauma, placing undue stress not just on the implant, but on your surrounding natural teeth and the temporomandibular joint, or TMJ, leading to widespread pain and tooth wear. We also show the difference between cement-retained versus screw-retained crowns, a huge choice affecting cleanability and long-term maintenance costs. The biggest lie sold by the industry is the phrase, "implants are for life." The most painful truth is what happens when a peri-implantitis-afflicted screw finally needs to be removed. Our 3D surgical visualization now shows the nightmare of implant removal. Unlike a natural tooth, which can be extracted relatively easily, a successfully integrated titanium screw is fused to the bone. Removing it requires specialized, aggressive drilling using a trephine burr that cuts a cylinder of bone around the implant. This process causes maximum bone loss in the area, significantly complicating future attempts to place a new implant. We also highlight the acute risk of inferior alveolar nerve damage during mandibular implant removal, which can lead to permanent numbness in the lip and chin. The hidden cost here is the potential necessity of an entirely new, complex bone reconstruction surgery after the screw is extracted. We have exposed the critical risks: grafting failure, peri-implantitis, abutment or bite misalignment, and the severe cost and complexity of removal. Implants are a medical marvel, but they are a massive financial and physical commitment. Do not proceed until you have received informed consent on all these specific, long-term risks. Always ask your surgeon about their experience with peri-implantitis revision. Before you invest, your homework is our next video, the 5 questions you must ask your dental implant dentist before surgery. Share this video with anyone considering this procedure. Thank you for trusting Dental Vision 3D with your health.